In this edition of the COVID-19 update, we take a look at how the disease has affected women in Guyana.
So in Guyana, so far, we've had about 61,853 cases overall. And of these cases, we've had 34,029 women being positive for COVID. And of this 34,029 persons, we have had about 2,901 who would have received at least one dose of a COVID-19 vaccine. 31,128 of these women who tested positive have not taken any vaccines. So this is really telling. We can say from all the data that we have, and there is lots of data right now, that vaccines in adolescent girls are quite safe. There haven't been any adverse events that have been recorded, so it is quite safe from all the tests that would have been done. And that is why it is recommended now, and we have been recommending that for some time now, that anyone 12 years and older can get one of the COVID-19 vaccines. So we have been administering that, and even with our local numbers, we haven't seen any adverse events. There are side effects that one would observe, and these are general side effects that you can have with any vaccine. So it's not limited to COVID-19 vaccine. No, and again, initially when vaccines first came out, there was a lot of talk about this, but again, very robust scientific studies were done, and it has been shown that it does not affect fertility. It is recommended by a lot of the obstetrics society that women during pregnancy or before pregnancy should take the COVID-19 vaccine. During pregnancy, women are generally at a higher risk because with pregnancy, your immune system is a little bit depressed, and therefore you are at a higher risk for COVID-19. So it is advisable that you should get the COVID-19 vaccine because it helps to protect you. So in any one of the trimesters, whether it's first, second, or third, it doesn't matter. You can take the vaccine, and once you take it, it is going to help to protect you. If the woman is breastfeeding, the baby would get the additional benefits from the mother being vaccinated, and then that is some of the antibodies that the vaccine would produce to fight off the COVID-19, some of those antibodies can pass through the breast milk and go to the baby, so it will help to protect the baby. In some cases, when you get the vaccine, because where it's normally administered in the deltoid muscle, the lymph nodes around that area can become enlarged for a limited period. So let's say for a week or two, it can become enlarged. This only happened to a few persons, but it is something that has been observed. So if you take the vaccine, you should tell your healthcare provider that is offering you the mammogram so that they can make a determination. Generally, after taking the vaccine, it's advisable that you wait at least 6 weeks and then do the mammogram, by which time those enlarged lymph nodes, if you have any, would be resolved, and therefore whatever you're seeing on the mammogram would be whatever else is there. So it would not affect the results of the mammogram. So vaccination in terms of adults, we've had 434,509 first doses. That's about 84.7% of the adult population. Second dose is 331,267, or 64.6% of the adult population. In terms of 12 to 17 age group, we have 33,803 first doses and 24,497 second doses. So that amounts to about 46.3% for first dose and 33.6% for second dose. Booster doses have been going up incrementally, I would say. So we are now at 53,144 booster doses. And again, Region 4, we have been administering most of the doses in Region 4. There's scope and there's room for other regions to really pick up. And there's no shortage of vaccines. Vaccines are available, and we really want people to come out and get their booster doses.
That was the International Women's Day edition of the COVID-19 update. I'm Natasha Smith-Thomas. Thank you for watching.